Welcome to the Catalyst Podcast. I'm your host, Charles Epstein. Joining me today is Michael Castanon, a behavioral health innovator dedicated to making compassionate, effective mental health care scalable. Michael is the founder and CEO of Alter Behavioral Health and Care Predictor, as well as founder of the Behavioral Health Outcomes Consortium, BHOC. We'll get to that toward the end of this conversation. Having deployed 24 million plus in grants to deliver roughly 500,000 no-cost virtual care encounters, Michael is now pioneering the science of care prediction. Through Care Predictor, he uses data and AI to quantify provider relational strengths like empathy and therapeutic alliance, turning the human element of healing into a measurable, repeatable science. Michael joins me today from Southern California. Michael, hi.
Hello, Charles. Glad to be here. Thanks for having me.
Thanks so much for taking the time. I know I'm not supposed to be jealous of other climates being down here in South Florida, although people tend to have probably a bit of a caricaturish notion of climate down here in South Florida. But where you live, I've always said, because I've been there several times, it's almost like it's the closest to being a climate control. It's almost like climate by thermostat. It's an amazing place to be.
I couldn't agree more, and I'm so grateful to be here. It's you travel around the world, you come back to this location, you're like, oh, that's right. That's why this place is so great. So, yes, it is a wonderful place to be.
That's why I decided to plant the 10 pegs here. Anyway, I really do appreciate this. Going through your background in the pre-production call, your journey has been pretty remarkable. Going from behavioral health, from a background in financial and predictive analytics, it's quite a journey. Take us through that evolution, if you will.
Yeah, I spent approximately 30 years in the banking industry, various, sort of roles within that world, private equity, investment banking, traditional retail banking. I ended up, most of my career in that world was really in real estate finance and real estate finance securitization, securitizing the loans and moving those through the secondary market of the financial markets. And one of the things that I went through in that journey, professionally speaking, was the understanding of, predictive analytics and modeling. And there was, this ability to sort of get very granular, almost if you remember the one-to-one marketing sort of terminology that was used in the 80s and the 90s. You could actually get to, understand individual behavior and begin to predict the need for financial products or the potential risk associated with potential borrower patterns in terms of, are they going to be able to debt service the loan that you're going to write to them? And you can price in sort of the risk aspect once you originated those financial products. So it was really a really great proving ground for me. And I never thought it was going to, prepare me for a completely different sector. In that world, everything is about money. It's a money makes the world go around in that world, literally. And you're providing funding and money for other people to make things in their world go around. But I found it to be extremely fulfilling. I don't know that you could go much higher on the ladder in a career than the one that I enjoyed in that industry. But I was wanting more. And I was wanting more because of my own personal journey and what I had sort of what I walked through as a human being, as my experience in life, where I was, highly successful and high performing, but I was deeply sort of hurting. I had this experience as a child of being terribly abused by a stepfather, sort of abandoned, not completely by my mother, but she was incapable of really advocating or protecting me the way that she probably wanted to at the time. And so I went through a really horrific, experience as a child. Probably the first 12 years plus of my life was, being abused and tortured. And it left me with some deep, self doubt and insecurities and lacking true confidence. And I used that as a fuel to get me pretty far in the world. But there had to be a time where I wanted to find true confidence and true security. And so, back then, about 12, 14 years ago, we didn't probably speak about these things the way we speak about them now. But now we would say that I had, mental health issues that I was dealing with. And when I went into treatment and dealt with this trauma, it was so enlightening. It was so freeing. It was so liberating. And I said, boy, I've got to put my personal experience and my professional experience together and do something for greater good. And hence I ended up entering the behavioral healthcare field.
That's an amazing story. And it must be incredibly fulfilling to be able to have these two worlds intersect, your professional, personal, and do something that's deeply meaningful to you.
I really can't put it into work, Charles. I mean, I try, and the best I can say is it makes my experience all worth having gone through. That I have, I remember as a child, literally crying, in my room, isolated and sort of locked up, in this dark, sequestered environment, very lonely and crying out, and that went on for many years. And I just say today, just the experience of having this ability to go through that and to be where I'm at today and make it meaningful and impactful for so many others. It exceeds anything that I could ever put into words. It is so fulfilling. It's so rewarding. And it's awe-inspiring, really, to have gone through that and to be where I'm at today.
One could easily surrender to some of those forces, but obviously you found the resolve within to have a successful career, a successful or fulfilling life up until you started this part of the journey. So, yeah, it's remarkable. And kudos. We could probably just focus on that story
Yes.
for the balance of this conversation. But I'm going to try my level best to pull us into some other directions, if you don't mind. And really, I appreciate you being so forthcoming
Thank you.
about this. And I think you're right that 10, 15 years ago, these conversations were not as easy for people to have as they are now. I wouldn't say that it has become, quote unquote, normalized, but I think the stigma has become significantly reduced where you could step forward and share stories of great pain in the way that you do. So that's really a great development.
We've come so far in that regard. I agree. I mean, I wouldn't even venture to have those kind of conversations, really, truth be told, 10, 15 years ago.
All right. As promised, we're going to pivot to this other stuff. So on our pre-production call, you explained how your background in data science led you to question why the behavioral health industry focuses on evidence-based modalities without understanding the drivers of positive outcomes. Explain this.
Well, my training, my background in predictive analytics, building models, using that experience and that know-how. When I came into this space, there were a lot of people, the industry was sort of looking at outcomes and wanting to, have the ability to deliver and drive outcomes regarding treatment and care, which I thought was commendable, and I loved it. I was drawn to it, Charles. I was actually motivated by it. As I looked further into it and using the discipline and the rigor and the practice that I'd learned in, predictive analytics and modeling, I was looking for the variable or the control for the outcome that was trying to be achieved here. in the care model. And I started to look into evidence-based modalities, which are, they are certainly, a number of modalities that do qualify as evidence-based. But as I looked more closely into it from a statistical standpoint, how did these evidence-based approaches or practices contribute to the desired outcome? And I couldn't find the connection, the correlation between the evidence-based modalities that were in play in the industry to the outcome. And so I put it this way, the outcome would be the output in a model. And in order to get the output, you have to know the input that will lead to that desired output. And so as I looked more closely as to what are the leading variables, the leading indicators, the primary drivers of the positive outcomes, I saw things more like therapeutic alliance or working alliance. I saw things like internal motivation of the patient or the client. And then I also saw things such as longitudinal support, ongoing care. Those things were leading variables, leading sort of controls of the desired quality outcomes that would lead to efficacious and sustained well-being. And so that's where I spent my time trying to understand and research and operationalize, really. When you did the intro, I think you did a really good intro, but really what we're trying to do is find a control for the variable, for these primary variables, and operationalize them to get the best outcomes for the patient.
And this led you to collaborating with a neuroscientist. So what was that collaboration about?
Well, I think the collaboration came about after, this quest and this sort of just this mindset, this perpetual kind of commitment to, insatiable curiosity. And so, when I started to think about what are the variables, what are the controls for these outcomes that we're all seeking in care, I started to make sort of, observations. And one of the observations was that there was sort of a commonality that I could observe as a layperson. I'm not a clinician. I'm not a psychologist. I'm not a psychiatrist by training or education. So I came in with sort of an outsider's perspective, and I'm really glad that I did, because I was able to see things through a different lens. And I observed that this impact of sort of people that had strong interpersonal skills or people skills that would maybe be deemed as soft skills, if they had this ability to make another person feel heard, seen, valued, and cared for, it appeared to me that the outcomes were far superior from those who didn't have these soft skills, these interpersonal or people skills. And so I was curious about that, and this is before I really had the deep understanding about the therapeutic alliance in theoretical terms, or the working alliance in theoretical terms. And so I would go around and ask all of the subject matter experts that I could find, almost in a pestering way. What is this thing I'm observing, and why are we not trying to quantify it or operationalize it? Why is it not in the proper hierarchy of the order of things in care? And a lot of people said, well, don't even try to, quantify that. You can't measure that. That's immeasurable. It's an unseen force. It's a vibe. It's not a variable. And others would say, oh, that's not quite as important as you think. The evidence-based modality is more important. My training is more important than that factor. And so I could not find somebody that was, in my world that cared about what I cared about. And I fortunately had met an educator that was at Azusa Pacific University, He was in liberal arts. His name is Dr. Matthew Smith. He's now the founder and CEO of Hildegard College in Southern California. And he and I started to collaborate, and he really took time to deeply understand what I cared about. And so we started to stumble on the science of the phrase or the construct of the science of human transformation. And we're really sort of trying to understand what is the scientific construct of human transformation. And he kind of raised his hand and said, I don't think I'm trained or qualified to do this. He said, but I do think I know somebody in our university who is. His name is Dr. Lauren Martin. He's the dean of the Doctoral School of Clinical Psychology, and he's also the chief researcher here at Azusa Pacific University. He's been with us for more than a decade as the chief researcher. I'd like to introduce you to him. And so I'll never forget, was introduced to Dr. Martin, and we sort of compared notes, and I told him what I was curious about. And he said, Michael, he said, you are onto something so important that the whole industry is overlooking, and even us as educators are overlooking. He said, it is one of my biggest pain points. I lament this quite a bit because I would say that 70% of those that I am educating and graduating into this industry, into this work, this field, don't have these interpersonal skills, these relational strengths that are going to make them effective at the work. And I said, that cannot be possible. He said, yes, it is. And so he said, but I'll tell you what, I think we can solve this problem. And he proposed putting together a research team of 12 academic researchers. He said, let's go through the publications. Let's take a deep dive into this and let's see what we can do. As they took a deep dive, they spent thousands of hours researching the publications. It certainly came very clear and evident that this relational capacity, this therapeutic alliance, was not only important, but it was the North Star for driving outcomes. It was the number one control, the number one variable, the input for the outcome. And 7 times greater, it turned out in the research, Charles, than the evidence-based modality. 7 times.
Wow.
Greater. And so when we saw that in the research and the publications, we said, well, how do we start to quantify this and operationalize it? And so he came up with a concept, a theory of using psychometrics and then using that to build a predictive index. And of course, when we started to talk about that, that was right up my alley. And so we did build this construct based on the research. We saw there were 21 relational traits that we believed we could measure using gold standard clinical instruments. And we could take that, reduce it down to math, and create an algorithm to predict these strengths within a person, to identify their capacity to, deliver the therapeutic alliance, to establish the therapeutic alliance. And what's amazing about this learning now, Charles, is that these traits and these capacities can be strengthened. They can be developed. I would argue that all of us have the ability to do that. Some of us come into our world through nurturing and through sort of DNA already sort of better than others. It's almost like if you're an athlete and you have that DNA and you have the biological predisposition to be, stronger than others. Of course, that's going to happen versus those who don't have that sort of biological predisposition. But the same thing can be done in this world. We can develop strengths. We can develop those capabilities in people. And that's the exciting part.
For sure. And of course, this became productized as Care Predictor. Yes.
Yes.
Okay, we're going to get to that in a moment. Just an aside, it's interesting you mentioned that you don't have clinical background or by education, the background one would assume you bring to this. And I think generally speaking, there is a diminishment of expertise in various fields in the general public. But I also think sometimes we diminish the value of what I'd call enlightened amateurism. When you have curiosity, humility, excuse me, and some of those soft skills in between, and some of those skills that you bring, the analytical stuff, you can create and produce innovative work. You can collaborate with people who perhaps have the more formal training, but bring to it a perspective that they simply do not have.
I think my experience sort of validates that. And I'm not saying that with pride. It's just my observation.
Sure.
I sort of teased earlier that I was glad that I had an outsider's perspective. I don't know that we would have gone down this path absent of that outsider perspective. Because when I talked to the subject matter experts that were coming from within the field, they did not see this through that lens. They did not think, most did not think that this could be quantified. It's an unseen force. How can you quantify this human resonance that we all know exists? It's obscure. It's but can you make it tangible? And fact of the matter is that through that understanding of how to do predictive analytics and me crossing paths with Dr. Martin, those two things came together beautifully to be able to achieve this objective.
So to back up a second, tell us a little bit more about Alter Behavioral Health.
Well, that's the beautiful origin story of Care Predictor, Charles, is that Alter Behavioral Health was in existence at this time. The reason why I was going down this path of solving this problem is because I was a owner-operator, a founder of a network of primary mental health facilities that provides crisis care and also residential care in a step-down continuum. We deal with highly acute patients in the crisis level, but then we also deal with those who are sort of dealing with depression and anxiety, which are probably the two primary presenting problems in mental health in this world right now. And I was wanting to deliver the best care possible. And I had observed that the people that were seeming to deliver that best care were the people that had these real true people skills. They had these soft skills that turned out to be hard skills. It was so hard to select for this, on the resume and traditional, interviews. How do you really authentically know that person that's going to show up in your organization is going to be able to resonate with somebody that is in desperate need for support and care when nobody else is looking? Are they going to be able to achieve that? And I couldn't do it as hard as I tried. I had over 200 staff at the time, Charles, and I thought I was a great enterprise builder, great culture builder. It was the most elusive, problematic thing that I had ever sought to solve for. That's the reason why Care Predictor was born, was to solve that problem. How could we reliably select staff that were going to be able to do this with another person that was in need of help when nobody else was watching? Right? It might stretch them. It might challenge them. It might be difficult for them, but even through that, they're going to do this thing. They're going to make someone feel seen, heard, valued, and cared for. I would say loved, right? And so that's why Care Predictor was born, because we wanted to have an organization that could be staffed and could be scaled with people that have relational competency and relational strength, relational excellence. And as we built Care Predictor, it was built only to provide the best care possible. And man, when we did that, Charles, it changed the whole ecosystem. The quality of care just went through the roof. The client engagement went through the roof. AMA rates, people leaving against clinical or medical advice dropped exponentially, and it was a game changer. And so when we saw that, we said we've got to get this out to the world. We got to have this out so people can make it essentially a standard of care. I'm less concerned about Care Predictor being a product than operationalizing the relational capacity of care providers and making it a standard of care. That's really what I care about, because it is a primary driver of a positive outcome. So how is it that we spend so much time focusing on the technical development, the education, but we haven't focused on the relational effectiveness and supporting providers to do that? It makes them more resilient. It makes them more effective. It's a gap that we overlooked. And so now we have this knowledge, we have this knowing, we have a responsibility now to do something with it so that more people really come into an ecosystem, come into care with a higher probability of a positive outcome. Because without this, Charles, it turns into a hit or miss proposition.
So how does it work? How does Care Predictor work?
Care Predictor, if you can imagine, you ever taken the Myers-Briggs or the DISC assessment, something, a Strength Finders assessment, the Enneagram, anything like that, if you've taken something like that in the past?
Yes. Mm-hmm.
What's beautiful, it's very similar in the mechanism. You basically fill out a survey, questionnaire, takes about 15 or 20 minutes on average to complete. And almost in real time, shortly after completing this assessment, this survey, then the algorithm goes to work. Through AI support, we are able to generate this very beautiful, supportive, comprehensive report, a care profile of the person that takes the assessment. And we lean into sort of just, from a strength-based approach, celebrating your strengths and also pointing out opportunities for improvement, for growth. And through that process, it's very enlightening, and it's empowerment that ends up happening because people are enlightened by these insights that are objective. They're not somebody's opinion or bias about you. It's actually the data says, hey, here's what we've learned about you. And now here's opportunities for you to grow in these areas. And equally, or even more importantly, here's the beautiful strengths about you. Lean into that. Do more of that. Double down on that. And if you do, we've done research, and we worked with a group out of Canada, the Decision Lab, world-class research group. And we learned that the primary driver of the behavioral health workforce, no matter where you are in the labor pool, your primary driver is that you want to help somebody transform their life and you want them to get better. So knowing that, and knowing that your relational strengths will help somebody get better, the more you grow your relational strengths, the stronger your relational strengths, the stronger the probability of the outcome. It so strongly aligns to the person's why, right? The person that's in the world of caregiving, it helps them to sort of just anchor to that why and develop and grow themselves to achieve the thing they want to do, which is help transform somebody else's life.
Fascinating. I want to get to, because we had a really interesting conversation to lead up to this about AI and technology, AI addiction. I want to get to that. But you also, again, you use terms like relational velocity, relational intelligence, obviously central to your work. How do those things show up? What are those concepts about?
Well, I think I would point you to the Harvard study on human development, and it's it's an approximately 85-year longitudinal research study on human happiness and flourishing. And in that study, in that work, it has been identified that the thing that is the number one driver of somebody's happiness or well-being is the quality of their relationships, their personal relationships. Not only is it a metric for or an indicator of your mental well-being, it is also equally an indicator of your physical well-being. And so we are, predisposed. We are social beings, and it's kind of interesting that we've never really helped our humanity gain understanding into what does it take to be effective, truly, scientifically, at achieving these quality relationships in order for you to have the purposeful or meaningful life that you want. And if we think about our own experience in life, so much of us achieving our meaning and our purpose is facilitated or supported through meaningful relationships that we've encountered along the way or developed along the way. So this whole relational capacity, Charles, shows up in every way possible. It is the primary driver of our success. It's the primary driver of our happiness and our well-being. It's crazy to think. And so, life happens in relationship. Healing happens in relationship. We are, our whole world is a relational world. And think about how sick the world has become when there is no effective relationship happening amongst those that have differing opinions or have, coming from a different mindset. It is, we become sick as a society, as a system, and individually. It creates heightened anxiety and depression.
Yeah, no, and this is particularly timeful in the moment we're living through right now, which actually brings me back to the whole AI issue. We've heard last year, couple of years, about the loneliness epidemic. People are developing relationships with chatbots that, for all intents and purposes, at least to them, feel like real relationships. And people are leading more and more isolated lives, even in our work. We're working at home more. We don't get out and interact face to face as much as we did. So it seems that, we may be at risk of a whole generation of people entering the workforce. And that's only one aspect. It's obviously more encompassing than that, but a whole generation of people entering the workforce who don't even have a good model of what relationships are about, what a healthy relationship is, why it's important. Does that concern you?
Well, that is my biggest concern in that I have. I think, as I told you about my experience as a child, I was forced into isolation. I was forced to do without proper nurturing, proper interaction. And I look at what that did to me, and now I see you talked about, perniciousness, the pernicious aspect of AI in our previous conversation. I would say it's pernicious and insidious. It is very toxic. The paradoxical nature of our advancing technology is that there are great things that can come from them. There are also some very bad things that can come from them as well, equally. And I think it really becomes even more complex and more dangerous when we use technology to replace what only human interaction is actually designed to do. And so we look at things like, AI and chatbots having relationships or interaction with technology. Well, that interaction is not the same as true human interaction. And what ends up happening is that you don't have the cognitive friction, the healthy conflict that might come from interaction. If you create too much velocity, it's problematic. You don't develop the social skills, to your point, or the social capital necessary to be effective when going out into the world. there are so many young people that have this, failure to launch dynamic. And I believe a big part of that is because of the lack of proper preparation through healthy social human to human interaction.
Yeah, we spoke, you recommended a book written by David Brooks called How to See a Person, the Art of Seeing Others Deeply and Being Deeply Seen, which I think goes to a lot of this.
Yeah.
And it in part talks about the need to lean into listening, to become better listeners. He refers to loud listening. And you and I talked about these days you could convince yourself that you were listening, but it really is not listening. You can go and find places to confirm what you think, what you feel. And the problem, as we discussed, is confirmation bias. So people think they're engaging in conversation. They think they're cultivating healthy relationships, but you'd argue that it's kind of an illusion because it's really not listening. It's not just a different form of listening. It's not listening.
No, it's actually amplifying, compounding, a mindset that you have already developed. And I think that, we talk about AI, the algorithm that is in the engine that serves up the confirmation bias that we see. You start to think about something, you start to research something online, inevitably you'll see that topic or that theme serve back up to you. And AI, independently is actually doing that. If you think about the power of that AI has that agent really that we talk about, agents that are being developed. Well, there have been agents that have already been deployed. They've already been at work, and they've been at work very powerfully in social media. And they have been doing the very thing you're talking about, which is sort of not really allowing you to properly communicate and listen. You're just feeding back to yourself in an echo chamber, things that you already are sort of curious about or beliefs that you already have that may not be entirely healthy, right? Opposing views are so healthy for us. The paradoxical nature of the human existence is that we are, in a reality where we are in a continuous process of development, but we are under the mistaken belief that we are a finished product. And it's that mistaken belief that we're a finished product that is the danger, right? In order to become who we really want to become, we have to allow space for opposing views, for others to come into our life and help us to sort of continuously grow and develop, learn, discover, and evolve.
Yeah, I'm reading a really interesting book, and it's written from the perspective of an evolutionary biologist. And one of the arguments he makes is that obviously, when we develop the capacity for speech and language, that we develop the ability to argue. And the ability to argue and advance your positions is a very important piece in our evolution. So I think we've also lost the ability to argue properly. We don't really argue. We talk past each other. Or again, we go to places where we can just get our points of view confirmed. Arguing is very healthy if you do it in a constructive way.
With civility.
With civility.
Civility. The issue right now is that we've lost civility. We've become very incivil, and it's inhumane. That is not how we are supposed to constructively go through dissenting opinions and discovery. It is really it is supposed to be a civil exchange, and that is what allows us to come to some sort of consensus and agreement. Without civility, we will not come to consensus or agreement, and that is where we've really lost our way. And that's part of this relational capacity, this construct that we've been able to measure is, the ability to interact with each other in a constructive, civil way.
Apart from actually doing something about it and being constructive and providing a solution with Care Predictor and some of your other work, what makes you optimistic that we are ultimately going to find our way?
I would say that the pendulum swings in, throughout history. And, I think we are going to go to a point where we are going to reach a point of tolerance, and we're going to exceed that. We all have this capacity for pain, and I think we're going to hit that pain threshold as society. And then again, this revival toward, more humane, more connected, more humane way of existing will come about. I have to believe in that, in that reality. I think I heard an educator talking about the dark ages. And I think for years, we sort of thought that, we just sort of lost our way. We stopped being interested in some of the, the literature and the works of some of the, great philosophers. And what she argued is that, no, it wasn't actually that at all. It was that there was this movement toward, sort of opposing those beliefs, and it moved us away from the knowledge and the enlightenment that we had achieved as a society, as humanity. And so, then we found our way back, right? We found our way back. And so I think we're going to find our way back eventually. And I think it's people that are willing to step into that opportunity to help guide people to find their way back. That's why I feel called to this work, is because I know we will find our way back. And that's what I'm believing and hoping for.
Well, yeah, from your lips, I think what ultimately is going to take, and I hate to bring this down to sort of a crass level, but as we know, contention means clicks, and clicks means advertising revenue. So obviously divisiveness sells. But if somehow somebody figures out how to monetize agreeableness, maybe we'll be onto something.
I'm working on that. I'm working on it. You think about turning it all on its head. If it can be used for bad, bad things, it can also be used for powerfully good things as well.
Amen. Amen.
Yes.
An excellent point to end this conversation on. But before I let you go, I do want to ask you about this event that you're holding in early September, the 2026 Behavioral Healthcare Outcomes Consortium, BHOC 26. Tell us a little bit about that.
Yes, the Behavioral Healthcare Outcomes Consortium is an event and a continuing organization that will help support and unify the behavioral health industry to get clarity and agreement around outcomes. We have a very highly siloed, fragmented, sort of bias-based system. It's a complex system because there are complexities within the various problems and issues we're trying to help solve within behavioral health. It's a large, it is a large sort of issue and a very broad issue. But if we can bring some uniformity and some simplicity to this complex issue, we will have a more sustainable, accountable, reliable ecosystem of care. So when people come into care, they have clear expectations on what they should be receiving when they are coming into the care environment. And we lack that right now. And so it makes it hard to provide a sustainable system, because even insurance payers are having a difficult time without this clarity. It just makes it hard to continue to fund and support. So BHOC 26, you can find us at www.bhop26.com. We're going to have policymakers, health plans, providers, technologists, researchers there, all unifying and coming together to simplify and create a uniform outcomes framework. That'll be at September 8th and 10th at the Waldorf Astoria Monarch Beach Resort in Dana Point. Again, www.bhawk26.com.
Yes, and the link is below to anybody interested in learning more. Please do check it out. Michael, I was really looking forward to this conversation. I'm going to have you back maybe later in the year. I also want to find, because obviously it's a moving target. It's an amazingly ambitious project, so I'm sure you're going to have some more to say and some more to report a little bit down the road. So if you have the time, I'd love to have you back.
Thanks, Charles. I've enjoyed it. Thank you so much.
Today, I spoke with Michael Castanon, a behavioral health innovator dedicated to making compassionate, effective mental health care scalable. Michael is the founder and CEO of Ulta Behavioral Health and Care Predictor, as well as founder of the Behavioral Health Outcomes Consortium. He joined me today from his home in HQ in Southern California. This is the Catalyst podcast brought to you by Chestnut Health Systems. For more, visit www.chestnut.org. Thanks for listening.